Why does Leader Thune and Senate Republicans continue to try to do the same thing and expect different results? Democrats are not going to bend, and we're not going to break, because we are standing up for the American people. And I'm very thankful for the courageous and principled position that Leader Schumer and Senate Democrats continue to take on behalf of the American people. House Republicans, on the other hand, remain on vacation. They've now canceled votes for 3 consecutive weeks. And Donald Trump is missing in action. He spent more time on the golf course during the 16 days of this government shutdown than he has talking to Democrats to try to reopen the government. You know, our hardworking federal employees are being asked to work without pay or have been furloughed. And the Republicans apparently could care less at the damage being done to the American people and the damage being done to civil servants who all they want to do is serve the American people. We need to sit down and have bipartisan conversations now. House Republicans should come back to Washington now. Donald Trump needs to re-engage now so we can reopen the government, enact a spending bill that actually meets the needs of the American people, and decisively address, once and for all, the Republican healthcare crisis that is devastating the American people. Questions?
I think Mr. Leader, you maintain that the path forward out of this shutdown is you, Leader Schumer, Leader Thune, and Speaker Johnson sitting down with the president to negotiate a deal. With all of these informal talks that are going on, you kind of mentioned them yesterday, going on in the Senate, is that still your posture, that the way out of this is leader-level talks that occur with the president to come to a deal?
The responsible thing for Donald Trump and House Republican, along with Senate Republican leaders, to do is for them to sit down so we can work this out in a bipartisan way. That's the responsible thing to do. Whenever we found ourselves, unfortunately, in a government shutdown in the past, that's always been the way out. But this group of Republicans who simply want to rubber stamp Donald Trump and haven't been given permission to sit down and have a conversation have adopted this position of my way or the highway. And Democrats have been clear. We're not going to support a partisan Republican spending bill that guts the health care of the American people. This is a major issue for millions of Americans all across the country, and it requires urgent action now. In terms of the informal conversations that are taking place in the Senate, as House Democrats, we've been clear. We will evaluate in good faith any bipartisan proposal that emerges from the Senate, as long as it is designed to accomplish 3 objectives: reopen the government, enact a spending bill that improves the quality of life of the American people, and addresses the Republican healthcare crisis. Thanks.
In terms of the timeline, obviously the shutdown doesn't look like it's ending anytime soon. You would like some changes made regarding subsidies. There's been talk of reform. This kind of law would require perhaps a lot of negotiation. How do you foresee this getting done in a short amount of time? What does the timeline look like?
Republicans have had multiple opportunities to extend the Affordable Care Act tax credits throughout the year. And every single time there's been a vote in either the House or the Senate, Republicans have uniformly voted against providing affordable health care to everyday Americans. And they've uniformly opposed extending the Affordable Care Act tax credits. Time has run out. Open enrollment starts on November 1st. Tens of millions of Americans right now are starting to receive notices that their premiums and copays and deductibles are going to go up. In some cases, by hundreds of dollars per month. In other cases, by more than $1,000 a month. meaning that there are Americans across the country, including in Mike Johnson's home state of Louisiana, that are going to experience increases that could total $20,000 a year. And these are Americans who together in their household make less than $100,000. In fact, more than 90% of the people who receive Affordable Care Act tax credits make around $63,000 a year. This is a cost of living issue that has to be decisively addressed now. Time has run out. And when the Republicans continue to insist that they're willing to sit down and have this discussion, Republicans are the same group of people who have tried to repeal the Affordable Care Act more than 70 times since 2010. The American people know they're not serious about addressing the healthcare crisis that they've created on their own, which is why it needs to be done now and needs to be done in a bipartisan manner with Democrats at the table.
Other things that are going to start happening November 1 are SNAP assistance.
Hold on. I'll go back to you in a minute.
All right.
Mr. Leader, when is the last time you had a conversation one-on-one with Speaker Johnson? And has there been anything fruitful that comes?
We haven't had a formal conversation at all during the shutdown. And in my view, that's because House Republican leadership hasn't been given permission to talk to Democrats by their boss, Donald Trump. We know that throughout the entire presidency, Republicans in the Congress have chosen to function like lapdogs for the Trump administration, a wholly owned subsidiary of Donald Trump and his administration. Nothing but rubber stamps for Donald Trump's extreme agenda. And so the only conclusion that I can draw as to why we haven't even had a bipartisan discussion about reopening the government is because Donald Trump has ordered Republicans to go radio silent. That is irresponsible. It's not what the American people want. And as Democrats, as Leader Schumer continues to say, as we in the House continue to say, we'll sit down with anyone, anytime, any place, either here at the Capitol or back at the White House, to reopen the government, find a bipartisan path forward, make sure that we support our hardworking federal civil servants, and address the Republican healthcare crisis that's devastating people throughout the country, including in rural America.
Okay, so November 1 is also a date where many of these same people that are concerned about healthcare are going to start seeing their emergency food assistance not arriving. It's also going to be a date where they're not going to see perhaps home heating support. How do you balance those needs with the needs you're fighting for right now in healthcare?
These are all issues, whether that's emergency food assistance, home heating, certainly access to high quality, affordable healthcare that Democrats have fought for, are fighting for, and will continue to fight for on behalf of the American people. And the American people know it. In this Congress, Republicans passed their one big ugly bill that hurt everyday Americans in order to reward their billionaire donors. In this Congress, that one big ugly bill included the largest cut to Medicaid in American history, and at the same time ripped away food from hungry children, women, seniors, and veterans by also visiting upon the American people the largest cut to nutritional assistance in American history. So all of these crisis events stem from Republican policies that are colliding at the same time, which is why Republicans are hiding, refuse to come back to Capitol Hill. And not a single one, as far as I can tell, has had a meaningful town hall meeting during the 3 weeks that they've been away from Washington, because they know they have a lot to answer for and they cannot justify their position.
So come November, you're going to have to make a choice?
The choice that needs to be made right now is that Republicans need to come to the negotiating table so we can work out a bipartisan agreement to reopen the government.
Thank you, Mr. Leader. Two questions. First, it's been reported that you're going to be participating participating in the protest this weekend, the No Kings rally. So
Reported by who?
Multiple reports. Unfortunately, I do not have them in front of me right now, but I'm seeking confirmation from you on that. And also, response to House Republicans, they've had a lot of rhetoric surrounding this protest, and you just said that you can't think of a meaningful town hall that a single member has had. They're really talking about all the work that they are doing in their districts with their constituents. So what's your reaction to them saying that they are working hard, saying they're not, they're saying it's theatrics and you're going to the, quote, Made America rally?
Well, I haven't confirmed my schedule for this weekend because it remains my hope that Republicans will actually come to their senses and decide that they need to get back into town and reopen the government with some degree of urgency on behalf of the American people. The notion that the No Kings rallies is anything other than a patriotic act consistent with the First Amendment right to express yourselves and petition the government for a change in policy continues to reveal that Republicans are clueless as it relates to the Constitution of the United States of America, or they continue to lie for political reasons. Right? There's nothing more patriotic in America than expressing yourself, particularly when it comes to expressing yourself in a peaceful manner related to disagreements that you have with government. Because this is an American experiment in democracy that's anchored in representative government of the people, by the people, and for the people. Over the last 5-6 weeks, we've heard all manner of toxic and malignant rhetoric from Republicans as opposed to actually addressing the problems that they've created, like the largest cut to Medicaid in American history, like the fact that Republicans are going to trigger a $536 billion cut to Medicare because of their one big ugly bill if Congress doesn't act by the end of this year, like the fact that Republican policies are leading to hospitals, nursing homes, and community-based health centers closing all across the country. And now they refuse to extend the Affordable Care Act tax credits, putting in jeopardy the quality of life of tens of millions of Americans who are going to face dramatically increased health care premiums and be unable to see a doctor when they need one. Instead of addressing the Republican health care crisis, devastating their own constituents and people across America, they continue to lie and spin and deceive.
Mr. Jefferson.
Thanks.
Speaking of toxic rhetoric, there's this controversy in Virginia where Jay Jones, the Democrat running for Attorney General, was found to have sent some explosive, some violent texts musing about the death of a Republican lawmaker. You have broadly and repeatedly condemned political violence of all stripes. But given the revelations about those texts, do you think that he should remain in the ring?
The Attorney General candidate has appropriately apologized for his remarks, and I know his remarks have been condemned across the board by Democrats in the Commonwealth and Virginia and beyond, and that's the right thing to do.
Mr. Jefferson, do you think what's happening in healthcare with people losing their insurance is a bigger crisis than the Trump administration, for example, illegally impounding funds or otherwise not following laws that were passed by Congress?
The Democratic alternative in terms of keeping the government funded, as well as addressing the Republican healthcare crisis, also has guardrails in it to make sure that if we reach a bipartisan agreement, House Democrats, Senate Democrats, House Republicans, Senate Republicans, on a spending bill that's signed into law by the president, that the policies contained in that spending bill are actually implemented by the administration. And that, of course, will remain an important topic of conversation and discussion. But we have made clear this healthcare crisis is devastating people across the country. Last week, we heard from a 29-year-old woman from rural West Virginia, Mariah Plant, who takes care of her brother full-time. Her brother is autistic, legally blind, entirely nonverbal. And Mariah is able to take care of her brother because of Medicaid at home in a loving environment. That Medicaid is now at risk for her and her neighbors in rural West Virginia, a state that Donald Trump won by 42 points. Mariah is also a small business entrepreneur of modest means. She gets her health care through Affordable Care Act tax credits. If those tax credits expire, Mariah Plant is going to lose health care or have to pay thousands of dollars more that she cannot afford. And Mariah's hospital in Wyoming County, West Virginia, rural West Virginia, is also at risk of closing because of Republican policies and the healthcare crisis that they've created. It's an urgent crisis. We're fighting for people like Mariah Plant, others in West Virginia, people in Wyoming, people in Alaska, in Tennessee and Mississippi. By the way, the 5 states that rely upon the Affordable Care Act tax credits the most. We're fighting for people in urban America, rural America, suburban America, small town America, the heartland of America, working class America, and black and brown communities throughout America, all of whom are being devastated by the Republican healthcare crisis, and all of whom need relief immediately. Thank you all. Thank you.